morning, everyone, and welcome to our webinar today, Social Engagements for Health, Part 2, Stories from the Field. My name is Andrea Bodkin, and I'm a Senior Program Specialist here at Public Health Ontario. I am coming to you today from the PHO office in downtown Toronto, which is on Treaty 13, the lands associated with the Toronto Purchase of 1805. I'm going to go over a couple of housekeeping items before we dive into today's presentation. To enhance the presentation experience, we have turned off the audio and video for participants and disabled the chat pod. If you have questions, and we will have a question period at the end of the webinar today, you can use the Q&A pod to ask those questions. And if you have any technical issues during the webinar today, you can email capacitybuilding@oahpp.ca. This is the second in a three-part webinar series on social environments for health. Last week, I gave a general overview of social environments, including what they are, the domains that make them up, and how they can be measured. Today, we have three amazing panelists that are going to tell us what building healthy social environments looks like at the local level. And February 5th, in just a couple of weeks, we have speakers from the Alliance for Healthier Communities who are going to talk about social prescribing for health equity. The picture that you see on your screen, and we're going to pop a link into the chat for our Focus on Social Environments for Health resource, which was published based on a literature review that I conducted over the summer period. And that Focus on provides most of the information that I spoke about last week about what social environments are, etc. Today, as I mentioned, we have our three amazing panelists who I'll mention or introduce in a moment. After they each have a few minutes to talk about their work at the local level, we're going to have a discussion between the four of us to draw some threads and continue talking about what building healthy social environments can look like. We're also going to have a Q&A session at the end of the webinar, so please do get your questions ready using the Q&A chat pod, and you can ask those questions at any time during the presentation. We'll just address them towards the end. So without any further ado, I'm going to introduce our incredible speakers for today. I'm just so excited to hear such three different perspectives about working in social environments. Alyssa Bedard is joining us from the North Bay Parry Sound District Health Unit, where she's a Community Development Coordinator with Planet Youth Nipissing. Ben Gallagher is coming to us from Mississauga from the Office of Emergency Management. And he's going to talk about his work on community resilience and social environments and emergency planning. And Inge Roosendaal is from Ottawa Public Health, and she is going to be talking about the links between the built environment and social environments. So with that, I'm going to pass the reins over to Alyssa to tell us all about Planet Youth Nipissing.
Thanks, Andrea, and hi, everyone. I'm joining you today from North Bay, Ontario, which is located on traditional Anishinaabe territory on lands of the peoples of Nipissing First Nation and Doki's First Nation, whose rights are recognized by the Robinson-Huron Treaty of 1850. I'm excited to be with you today to share about the collective impact initiative I'm coordinating called Planet Youth Nipissing. So let's get right into it. So Planet Youth Nipissing is based on the Icelandic prevention model, which is an evidence-based approach developed to improve youth well-being and prevent outcomes like substance use. So the Planet Youth approach uses local survey data to regularly collect data, better understand what's going on in the lives of young people, and this allows communities to respond by creating locally relevant solutions focused on prevention. So communities invest in youth by shifting the social environment so that they're growing up in so that they are more likely to thrive. Communities can provide supports, opportunities so that youth feel valued, engaged, and connected. So Iceland implemented their prevention model in the late 1990s. The results from their youth survey showed a downward trend of teen drunkenness, smoking, and cannabis use. So you can see that this change took place over a number of years, and they didn't achieve this success by simply educating youth about the dangers of alcohol and drug use. They had tried this method before, and it wasn't working. The approach they developed and started implementing in the 90s had shifted toward addressing risk and protective factors in youth's social environment. The frameworks that ground the work that was done in Iceland include 5 guiding principles and 10 steps. So the first guiding principle emphasizes the importance of focusing on upstream prevention through enhancing the social environment. Other principles include emphasizing community action and embracing schools as neighborhood hubs, empowering community members with high-quality data, connecting research, policy, and practice, and matching the scope of the solution to the scope of the problem to commit to the work long-term. The 10 steps of the Icelandic prevention model involve building a local coalition to lead the work, identifying sources of funding, collecting student data through school surveys, sharing the findings with the community, and using that data to set goals and implement interventions that address the risk and protective factors that showed up in the survey. And this cycle repeats every 2 years. So the model aims to address risk and protective factors within 4 areas of a young person's life: family, peer group, school, and leisure time outside of the school. So essentially social environments that they're spending their time in. So some of the factors are listed here and include a young person's access to support and warmth from their parents or guardians, being able to discuss personal matters with them, spending time with their parents, and parents knowing where their kids are in their free time. Also having safe adults to talk to at school, participating in organized activities, and a sense of belonging in the community and within the peer group are all key. So I wanted to show some examples of the types of questions that the student survey asks and show them in terms of the domains that were presented in the Social Environments for Health Focus On article that Andrea mentioned. So in terms of social support, students are asked how easy or difficult it is to receive support from their parents or guardians related to caring and warmth, discussion on personal matters, advice about schoolwork and other things, and assistance with activities. Youth are asked whether they have friends at school that care about them, whether adults at the school care about them, help them, and seem safe to be around, and whether neighbors might intervene if trouble was happening in the neighborhood. In terms of social engagement, the survey digs into some questions around participation in activities in the community like arts, sports, church groups, volunteering, cultural activities, or other leisure time activities. Social cohesion and social network are asked about in terms of how students perceive their family's connection to their neighbors, for example, whether their parents have friends nearby, know their neighbors by name, or might borrow things from each other. There are also questions about students, friends, and peer connections at school. In terms of safety, students are asked whether they feel safe in their neighborhood or community, in the school and at home, and students are asked whether they think that there are many activities available for youth in their community. So one of the key features of the Planet Youth data is the cross-tabulation between risk and protective factors and substance use. So this allows communities to see which factors in a youth's environment are linked with substance use behaviors. So what we see here is the cross-tabulation between ability to receive caring and warmth from parents and past 30-day drunkenness, cannabis use, and daily e-cigarette use. So the purple bars show teens that find it rather easy or very easy to receive caring and warmth and who use substances. And the gray bars show the teens that find it very difficult or rather difficult to receive caring and warmth and who use substances. So what we see is that among those who find it easy to receive caring and warmth, prevalence of substance use is lower than among those who find it difficult to receive this caring and warmth. So essentially, this allows communities to identify which protective and risk factors are present in the social environment and then prioritize where to target interventions. So now, looking at some examples of interventions, and then I'll get to talking about where we're at locally, but these are some examples from Iceland as well as from other Planet Youth communities around the world that they're using to intervene on the social environment for youth. So Iceland implemented some changes to their alcohol and tobacco policies in response to their data by raising the legal age to buy these products and banning advertising toward youth. Parents were also encouraged to spend more time with their children rather than occasional quality time. Iceland also introduced outdoor hours rules where groups of parent volunteers would walk the neighborhoods at a certain hour and encourage youth to be heading home so that they weren't hanging out after dark unsupervised. Iceland also increased funding for organized sport, arts, and other clubs through their leisure card system. So this gave youth access to social environments where they could find sense of belonging, build skills, and connect with caring adults and other youth. So communities in the US have since replicated this initiative with promising results. Parental agreements were established in some communities by and for parents around things like not allowing their kids to have unsupervised parties. So these agreements were meant to shift social norms for the whole cohort of youth. Communities in Ireland, as a Planet Youth site, have started their Parent Power initiative, which provides support and guidance to parents around tricky areas like screen time and sleep. Kentucky in the US has initiated parent cafes, which are monthly organized get-togethers led by parents for parents. They're free and open to everyone, and they include dinner, childcare, and activities for youth. And the purpose is to bring parents together to provide a space free of judgment where they can talk and learn from each other about the challenges and victories of raising a family. In Vermont, youth councils have established a participatory budgeting process where youth can come up with ideas for things they want to see happen in their community, and then youth can also vote on what projects they want to have funded. So examples include things like a create and skate, community murals, a game room, open mic and barbecue, and more. So as you can see, interventions are diverse and they reflect the needs and context of the local community. The survey measures outcomes at the teen level, but interventions are broad and aim to shift the social environment for young children all the way through to the teen years. So in terms of where our current Planet Youth Nipissing work is at, we're in the process of disseminating our survey findings, which were collected in the spring of this year, of 2024, and we're engaging our local community, including youth, to talk about these findings and identify some priorities that have emerged from the data. Next, we'll be setting goals. We'll be setting goals and action planning based on this data and engagement, and then implementing what we planned. So we're at an exciting phase right now of sharing and talking to community. So this is just my last section here on evaluation. So in addition to the survey that's done every 2 years to track changes, we're developing process and outcome evaluation indicators with the support of some frameworks from Iceland and guides from Public Health Agency of Canada. And we've got academic researchers as part of our local work who are supporting this part. So with that, I'll just mention we have a website, planetyouthnippissing.ca, and I'll pass it back to Andrea. Thank you.
Thank you so much, Alyssa. It's so exciting to hear what is happening internationally and in North Bay. And I just wanted to, a real dot that you connected for me is thinking about those domains in the social environment as protective factors for a variety of behaviors. So I just really love that example. So I'm going to pass the mic, as it were, over to Ben Gallagher now from the City of Mississauga. Thanks, Ben.
Thanks so much, Andrea, and good morning, everyone. As Andrea mentioned, I'm going to be talking a bit about how the social environment can assist in resilient communities. But first, I just want to say I'm presenting today from the City of Mississauga. I acknowledge the lands which constitute the present-day City of Mississauga as being part of the treaty and traditional territory of the Mississaugas of the Credit First Nation, the Haudenosaunee Confederacy, and the Huron-Wendat and Wyandot nations. I recognize these peoples and their ancestors as people who inhabited these lands since time immemorial, and the City of Mississauga is home to many global Indigenous peoples. So to provide a bit of background, modern emergency management in North America actually has a lot of its origins coming from the post-World War II civil defense Cold War era, which really placed an emphasis on individual preparedness. The idea being that if we were to experience an attack from another country, everyone would get down to the bunkers, eat their canned food, and listen to the radio for updates from the government and be self-sufficient during an emergency. And most current emergency preparedness messaging still emphasizes this individual approach to preparedness, where people and families are recommended to have an emergency kit, a family plan, and to stay informed. And there are definitely actions that people can take at the individual level to make sure they're prepared for emergencies. For example, having home insurance and proper coverage is going to make a huge difference during an emergency. However, there's been a lot of emerging research over the past several years that demonstrate that some of these types of self-serving efforts don't actually result in a person being more resilient to emergencies. And what this research has found is that it's actually the amount of social capital and the strength of our social environments that has potentially the most significant impact on community resilience during and following emergencies. So I'll get back to talk about the research in a second, but in the emergency management context, I generally follow the definition of social capital used by the United States Federal Emergency Management Agency, or FEMA. And how FEMA defines social capital is social capital comes from networks, norms, and trusts that support collective action for a common purpose and that results in mutual benefit. It includes bonds within community groups across different populations and the relationship between those in positions of authority and the broader community. It's the intangible connection and trust between people and among community groups that is built through formal and informal interactions. So I'll come back to this last line in the definition later because I think the emphasis on the intangible is really important. But getting back to the research, over the course of the past 15 to 20 years, a lot of different research and books have begun to emerge highlighting the important role that social environments have in making people more resilient for emergencies. So I've included just a few of my personal favorite books on the screen here, including Daniel Aldrich's Building Resilience, Social Capital and Post-Disaster Recovery, Heat Wave by Eric Klinenberg, and A Paradise Built in Hell by Rebecca Solnit. But there are a ton of other research papers and resources out there that support this emphasis on social environments in disaster affected communities. So like anything, it usually takes government a bit of time to catch up with the research, but we are living in a pretty cool time right now because just last year, FEMA in the United States released their National Resilience Guidance Framing Paper. And this was a really refreshing document to read because it moved away from some of the more traditional emergency preparedness ideologies and instead placed a strong emphasis on community connections over individual preparedness. The importance that social capital has on community resilience is referenced throughout the document, and the paper even includes an entire section on community and social systems. Similarly, the Chief Public Health Officer of Canada's report on the state of public health in Canada in 2023, titled Creating the Conditions for Resilient Communities, a Public Health Approach to Emergencies, also raised the challenge that resilience has traditionally focused on self-reliance as opposed to other important underlying social issues. So this document emphasized the role that strong social infrastructure and social environments has on resilience, and that people's behavioral choices leading up to, during, and following emergencies can either be supported or constrained by their social and built environments. So like I said, this is super exciting that we now have government departments at the federal level in both Canada and the United States catching up to and advocating for these ideas that have been emerging in the research for several years now. But now our challenge at the local level is how do we try and implement some of this? So in Mississauga, we are participating in a number of different initiatives that are geared towards fostering healthy and resilient social environments. So one of these is the city's Cooksville SNAP program, and you may be familiar with SNAP programs already as they exist in other areas, with SNAP standing for Sustainable Neighborhood Action Plan. So the Cooksville SNAP is a partnership between the city, Credit Valley Conservation Authority, and a number of other different partners and community organizations. And the aim of the Cooksville SNAP is to create a plan with a series of different action items that can be taken to make the Cooksville community in Mississauga healthier and ready for climate change. And these aren't actions that are either completely implemented by the local government or entirely downloaded to the community to implement themselves. But really the goal is to have a partnership between the community and the various institutions to collaborate on implementing these actions together. So I won't go through all of the actions from the plan because there are a lot of them, but they include things like increasing safe and active mobility within communities, ensuring the community is better prepared for extreme weather events, developing nature-based programming in the community, and increasing neighborhood food security through things like seed libraries and cooking workshops, and all things that really help enhance the social capital and social connection within the neighborhood with an emphasis on environmental sustainability. So in addition to the Cooksville SNAP program, we are also working on implementing the city's Resilience Hub program. And the idea behind the Resilience Hub program is that it provides a social environment infrastructure for community members to be able to share knowledge, resources, and information with each other before, during, and after climate-related emergencies to ensure that they're prepared and resilient. And when we think of resilience hubs, we often think of a physical location filled with different physical equipment that could be used by community members during an emergency, like shovels or hard hats or sandbags or whatever it might be. And while having a physical gathering point is super important for communities, what we really want to try and emphasize with the Resilience Hub program is not the emphasis on the physical things that these hubs might provide, but instead the social network and social environment that these hubs can help facilitate. Because again, it really is that social connection that is the most beneficial for resource and information sharing before, during, and after emergencies. So we still have a ways to go on the Resilience Hub initiative, but we are working with the community to incorporate their feedback into our engagement efforts, meeting these community members where they are and providing things like emergency preparedness workshops and presentations at community-led events like coffee nights and games nights that we attend that are hosted by local community-based organizations. And I think it's important to note that neither of these two initiatives are our own in the city's Office of Emergency Management, so I don't want to make it seem like I'm taking credit for them, but I think the real benefit of these initiatives is that they demonstrate the co-benefits that this type of social environment work has on the various partners that are involved, whether that's emergency preparedness, climate change resilience, public health, food security, etc. So with these programs that we are working on, they do have some challenges that we encounter with them. That being said, I think these challenges are also actually really good opportunities for us. So the first challenge is, how do we measure success? And this is challenging to do because, just like it said in the FEMA definition, social capital is largely intangible. So it's hard for us to quantify levels of social capital with these types of programs and the difference we're making. And it was a lot easier with some of our old programming to say, well, we've attended X amount of events and talked to X amount of people, given away X amount of brochures, etc. But those metrics didn't really demonstrate whether people were prepared for emergencies either. So one way in which we've tried to measure success is that we've partnered with the University of Toronto Mississauga campus on a research project that was conducted last summer that examined the levels of social capital in our overhoused seniors populations, where researchers from the university conducted surveys and engaged with focus groups in some of these communities. So the results were super interesting, and they also had benefits for other city divisions like our recreation and environment teams. And this helped us gauge how residents felt in their current social environments and identify what kind of actions could help increase their perceived levels of social capital. So as Alyssa mentioned, if you have the opportunity to partner with academia, I highly recommend it because they have a tremendous ability to conduct program evaluation. And finally, our last challenge, which I alluded to earlier, is that the social environment and everything that goes into it is a very broad societal issue that goes beyond any one group or agency individually. And so I think this can be challenging for us as emergency managers or any single profession to feel like we have a role to play in some of the things that relate to the social environment. Because what do we as emergency managers really know about active transportation or urban planning or public health? But while I think this may seem like a challenge, I think we've also used it as a really great opportunity to work with our partners to explore opportunities to collaborate and really use that systems thinking approach to demonstrate that the co-benefits of this type of work has benefits in all of our different areas. Like I mentioned, that research project we did last summer didn't just benefit us, but it had implications for our recreation, planning, climate change teams, etc. And so I think while we as emergency managers have always worked very closely with our traditional partners like police, fire, and paramedics, what we're now trying to do is connect with some of our non-traditional partners whose work is related to healthy social environments to demonstrate that this work also benefits disaster resilience. So my closing message would just be to any public health folks on the call or anyone whose work relates to social environments to connect with your local emergency manager to see how they approach community resilience and if there's any ways that you can collaborate together and if the work that they are doing may also benefit you as well. So I'll pass it back over to Andrea. I've left my contact information on the screen here and looking forward to the discussion at the end.
Thank you so much, Ben. It's just fascinating to hear about the intersections of emergency management and social environments. When we first met a few weeks ago, I was like, really, these two things go together, but I think you have demonstrated how emergency management being at the table can really help to build social environments, and especially with initiatives that are already going on. So thank you so much for that. So I'm going to pass the mic over to Inge, who is our last speaker. I went in alphabetical order. And then following Inge's presentation, we'll have a bit of a discussion to tie some of those threads together. Thanks, Inge.
Thanks so much, Andrea. And kind of, even though we're in alphabetical order, I feel like this makes logical sense too. So kudos to you for organizing it this way. So it's great to be joining you all this morning. I'd like to take just a moment to begin by honoring the Algonquin and Anishinaabe people on whose traditional unceded territory the City of Ottawa is located. And I'd like to extend this respect to all First Nations, Inuit and Métis people, their ancestors and their elders for their valuable past and present contributions to this land. There we go. All right. So the bricks and mortars of our communities, the streets, the public spaces, the places we live, they're all so deeply linked to how we feel and how we connect with each other. I've been working in this space dedicated to building healthy communities for, jeepers, I want to say around 20 years now, so for quite some time, and it's really been a fascinating journey. As a public health practitioner and as an urban planner, I do find myself in a really neat spot, bridging two sectors. And although I work for Ottawa Public Health, as Andrea mentioned, I'm co-located with the City of Ottawa's Planning Department. And what this means is that I get to collaborate with planners and engineers, and I get to help write and interpret planning policies and guidelines and basically provide an ongoing health impact assessment. So my work involves grappling with those kind of really wicked questions, as we call them these days, these complex boundary spanning population health issues like chronic disease, mental well-being, and climate change, and thinking about how places can be enablers or inhibitors. And I've learned that there is tremendous potential when we collaborate across sectors, particularly in the kind of work that I do with those responsible for the evolution of our built environment. So this is a presentation that's going to be focused on healthy public policy for the built environment as a real important lever for creating healthy social environments. And let me walk you through some of the ways that we've been approaching that here in Ottawa. I'll be talking today in particular about that neighborhood characteristics domain in PHO's literature review on social environments. So just up there on the screen, and they're certainly connected with all the other domains as well. So we know that our communities and public spaces are where we build connection, resiliency, and empathy for one another. These are the spaces where we solve problems, where we exchange ideas, and where we support each other. But our physical environments do have to facilitate these interactions. Urban and community planning really concentrates on how things like land uses and transportation are arranged and designed in our built environments, but we're becoming increasingly aware of the absolutely critical role it plays in creating the right conditions for people to thrive. The way we design our built environment matters. The factors that improve physical health through the built environment are deeply interconnected with those that improve our social environment. And so all the policies and the guidelines and the decision-making frameworks that concern planners and impact the built environment also have enormous ripple effects on social well-being. But there are just a ton of elements in the built environment that impact health and well-being, and it can get really hard to untangle and unpack. I have found that messaging is really important. And so in Ottawa, what we've tried to do is translate the science into some more digestible frameworks. The first of these frameworks I'm going to talk about this morning is what we call our 5 Cs. You got them up on the screen there. It doesn't mean that these are the only inputs, but this helps us communicate some of the key drivers and translate some of that science. I'll go over them quickly because it will give you a little bit more of a sense of the kinds of things that we do promote here in Ottawa. First, we have complete communities. And what we mean by that is we want to aim for a diverse mix of land uses with different kinds of housing for all stages of life. We also encourage lots of local amenities and services like shops and schools and parks. These things enable people to rely less on a car and engage more in their local community for their daily needs as they walk about. The second is we need our communities to be compact. Complete communities rely on compact communities, on higher housing densities to make sure that those local shops and services are economically viable. Like you need enough people, right, to create that critical mass and to reduce urban sprawl. So compact communities help bring people and services closer together. And when many people live close to the things that they need every day, we need well-connected and complete streets. This means that streets are safe, they're convenient, and they're attractive for walking and biking, which is, as I'm sure all of you on the call know, is so important for well-being in so many different ways. And fourthly, cool and green. It's hard to remember on a day like today, where in many parts of Ottawa it's really, really cold, or in Ontario it's really cold. It is getting hotter out there. Trees and green spaces help protect us from a changing climate, and they frankly make being outside more enjoyable and make us feel better physically and mentally, even on a cold day like today. And my fifth C here on the screen is my favorite. It's this notion of conviviality. We want our neighborhoods to feel convivial. We want neighborhoods that just feel great to be in. There's no exact recipe, but think about your favorite neighborhoods to visit. I'm going to guess they probably have elements of conviviality. They have people on the street. They have places to sit. They are lovely, joyful, with fun elements. They feature public spaces that serve as beating hearts of communities, nudging us to connect and to linger. So now that we've covered some of these key ideas, let's look at some practical examples of how these concepts come to life and what it means on the ground. I'll just unpack these ideas from the perspective of children's well-being. We know it's incredibly important for kids to be able to safely navigate their communities. We know that that promotes their health, it builds their independence and resilience, all those good things. The popsicle test is can help bring some of these ideas to life. It's kind of a fun pulse check to see how child-friendly a neighborhood is. Basically, it asks, would you let your child walk to get a popsicle by themselves? And can they get it home before it melts? On a hot day, of course. So as we go through this, think about your own neighborhood or neighborhoods that you're familiar with and how it would fare in this popsicle test. For a good outcome on a popsicle test, you would need a number of things in that built environment. On a very hot day, you would need street trees to create a shaded walk to the store. You would need sidewalks along streets that don't feel like highways and provide safety. You would need houses in the neighborhood that are near the stores that sell the popsicles. You would want the area to be one that has what we call in planning sometimes eyes on the street, which means that there are people out and about, some of whom you might know or recognize, which does contribute to feelings of safety. And if you have all these things, you likely have many of those 5 C's we just went through. And that are also you probably have many of the domains that are listed in Public Health Ontario's Lit Review, especially elements and domains such as social capital and safety. Ultimately, we know that when a neighborhood works for kids, it works better for everyone. All right, now, how you go about advancing all these bits and pieces through policy in the built environment is probably a whole other webinar, but in broad strokes, in Ottawa, we've leveraged one of the most important municipal planning levers, and that is the city's official plan. This is the municipal policy blueprint that governs how land use in a community can be used, developed, and built up over the next 25 years. It's incredibly important because it has a ripple effect across all built environment decision-making in a jurisdiction. If it's not in the official plan, it's not necessarily required. Ottawa has recently adopted a completely new official plan, and we were so lucky we were on the planning department's writing team for it. This gave us a wonderful opportunity to integrate a whole range of those healthy community ideas we just reviewed and translate them into policies that impact social well-being. One of the biggest levers has been encoding the idea of 15-minute neighborhoods as the fundamental framework for how we grow. The 15-minute neighborhoods pulls into it all those 5 C's I just went through. It's an approach that enables people to meet their daily needs within a 15-minute walk by bringing services closer to home. It promotes active transportation, green spaces, affordable housing, and climate resiliency. We continue to work with our partners in planning to implement this new official plan and support decision-making that helps create healthy, walkable, and inclusive communities. And this includes working on all kinds of technical planning policies like master plans and secondary plans, and down to development applications. So I hope I've given you a bit of a bird's eye view of how social environments are tangled up in how we structure the built environment. We do need to work across sectors to meaningfully improve social cohesion and well-being. And I encourage you to engage with your local planning departments, share the science, and highlight the enormous impacts that neighborhood characteristics have on social cohesion, social capital, and human well-being. And that cities need to be designed with human health and well-being in mind. Thank you so much. And now I will pass it on back to Andrea.
Inge, thank you so much, and for introducing me to a new word, or if I did know it, I've forgotten it, convivial. What I loved about your presentation was talking about places as enablers or barriers. And I don't think I had really thought about that before your presentation, so thank you so much for that. We're all going to come on camera, the four of us. And we're going to get rid of that slide deck so that you can see our charming faces, if I may say that about my own face. And we're just going to have a bit of a discussion to pull some of those threads together. One of the things that I love about this work and the stories that you all told is that it illustrates that social environments are not a new thing. You know, and the research that I looked at for the Focus On that we mentioned earlier, a lot of this work goes right back to the 80s, but that you're each, because you're working in different places and different contexts and different areas of the province with different populations, et cetera, you're all kind of pulling out different aspects or domains of the social environment for your work. So I thought maybe we could just talk a little bit about those differences and similarities. So Alyssa, you talked about really all 6 of those domains: social support, social connection, you know, coming from parents and peers and schools. Ben, you talked about resilience and social capital. Inge, you talked about place and neighborhood and safety. But one of the things that I heard in common from all of you was this idea of connection, that we're bringing people together in some kind of way, not only to actually, you know, in public health and health promotion, we often gather people to, you know, conduct an initiative or do something together, but there's just something a little different about the social environment. It's not really a question, but I'm wondering if you can all kind of jump in on that and maybe share your thoughts about that connecting aspects.
I can just get us started. I think that very much resonates, Andrea, with the work of the Icelandic prevention model and just the communities that, well, in our local community and also the communities I've connected with, is just that connection piece really transcends kind of all those different areas that we're trying to address around the school setting, the parent and family setting, with peers, leisure time. So I just feel like that is, if we sometimes want to frame the work in not such a negative way that we're preventing substance use, it's more about improving the lives of young people, trying to make our community the best place for them to grow up. It's really about that connection piece. So it's kind of just the way to sort of flip the work and focus on that end of things.
Absolutely. And I can just add, I think from our perspective, I think one of the challenges we see is that connectedness is becoming harder and harder to connect. And there's these big societal forces that are making it more challenging for people to connect. And so as emergency managers, if we know the evidence says that people need to be connected to be resilient, that can be very daunting for us. But I think, as I mentioned in my presentation, I might not have to be an expert on the built environment or active transportation, but I think if we can all kind of collectively work towards this together, it doesn't rest solely on the shoulders of one department or one group, but if we're all kind of working towards the same goal, that makes it a little less daunting.
Yeah, what struck me when Ben was speaking during his presentation, he used the the phrase kind of systems thinking, and I think connection and systems thinking, it all goes together. We cannot tackle the kinds of societal issues that we have today that rely on social cohesion, social connection, social environments without this deep recognition of how we have to work together in very new ways and find creative ways to create those conditions for people to thrive, whether it's a child, in a challenging situation, an emergency that comes up, or the neighborhood they live in, all of which are entangled, right? I mean, the child cannot thrive in an emergency if they're living in a community that doesn't offer, the infrastructure to allow them to do that. So it's all so entangled. So yeah.
So really, there's so much flexibility with a social environments framework or approach. And I'm hearing that there are a lot of win-wins where, each of you and I, we each have our own goals for our work around social environments or how we make those connections. How can we find those win-wins with the folks that we're connecting with, that we're working with? How do we frame that? Because for a lot of people, if I and Ben, not to make too much fun of emergency management, but if I walked into an emergency management meeting and said I'm here to talk about social environments, there'd be people in the room that would say, okay, cool, yeah, that makes sense. And there would be others going, we have other things to do. So how can we frame this work so that the folks that we're linking with and talking with can see their work with the social environments? Just a tiny little question, folks.
I can take a first crack at that based on my own experience. I find it's really helpful to get a good understanding of where your partners are coming from first, understand what their goals are, what their constraints are, and then find out where the point of intersection and commonality is, and then help them. As opposed to, if I'm working with Ben on, built environment and climate change, as opposed to saying, Ben, can you help me on the health stuff? As it relates to climate resiliency, Ben, where are you running into challenges, and how might public health offer you with information, knowledge, and science to help advance your goals? Find that sweet spot of intersect,
Yeah, just to build on that, one small example that comes to mind is just one of our main partners in this work is the schools and the school boards. And one of the issues that they face is sometimes school attendance for students. So in kind of digging into the work, finding out if it's that students are not feeling safe at school, or there's nothing there that's kind of driving them to be the best they can be, like they're kind of feeling disengaged with school, that can link with a lack of school attendance. So by trying to kind of find those commonalities, like Inge said, to see what are their goals, it's around education. And of course, that's a huge social determinant of health. We care about that too in public health, but this work can link to that. So it's just kind of finding those points of commonality.
I just add to, in addition to the work we do with the different city departments, with the public as well, I think even if people aren't consciously thinking about it all the time, the social environment stuff and the connection does really resonate with people. So when we're working with our community groups and they're asking of us how to be prepared for emergency and things like emergency kits and supplies and things like that, and we just frame it that different way to say, well, really the most important thing you can do is get to know your neighbors and get involved with your community. It kind of does really resonate with them, and they kind of have that, oh yeah, moment. That was really in the last power outage I had, I called so-and-so where I worked with my neighbors. And so I think people do inherently understand this stuff. And I think it's just kind of making sure that it's raised and that we're talking about it.
Thank you so much for that, everyone. So great to hear all of your examples in this discussion. So I'm just looking at the Q&A pod and we have 15 questions. So I think we're going to move over to our Q&A. First of all, there is someone that wanted us to put up a slide from Alyssa's presentation that they missed. So my colleagues are going to put that up on the slide. While I go to the first question. Yes. The evaluation slide, I should have guessed it would be that one. Okay, so the first question we have is for Alyssa. Who are the partners involved with Planet Youth?
Yeah, thank you. So as I kind of touched on, Planet Youth has like a process that we're following locally, and they have kind of like a framework of various partners that should be involved in the local coalition. So I'm looking at it right now, and if it's helpful, I can figure out a way to send it. But we have our partners also listed on our Planet Youth Nipissing website, but we've got sectors represented, including public health, of course, schools and school boards, municipalities. Our local CMHA and youth mental health organizations are involved. We've got representatives from the leisure time sector, including the YMCA, a local safe space for 2S LGBTQ youth. We've got a local Indigenous Friendship Center involved, lived experience in recovery, police services. I'm just kind of going through our list here, hospitals, social services. So we have quite a wide range of partners involved. And the idea is that people that can impact, or people or organizations that can impact the lives of youth in any sort of way are welcome to join into this, so that we're all kind of looking at the same data and working together. So that's just a quick glimpse of the partners involved. But again, you can visit the website to see specifically who's on our coalition.
And we have the same question for Ben. What partners are part of SNAP and the resilience hubs?
Thanks for the question. Yeah, similar to Alyssa, it's pretty extensive. So for the Cooksville SNAP program, it's just about almost every city division, everything from our planning and engineering folks to our libraries to emergency management, active transportation. And so it really has pretty extensive representation from the city, but there's also representation from the region of Peel, a lot of departments from the Conservation Authority, and then those community-based organizations as well that operate out of Cooksville. So that's a range from groups that work with newcomers to our environmental sustainability community-based organizations. We do have quite an extensive group that we've brought in together several times, and it's kind of an open invitation to the community for some of these feedback events that we have. For the Resilience Hub program, it's very much the same, more so on the emergency preparedness side. So from the city, currently it's our Office of Emergency Management and our environment team, and then opening it up as we need to other city divisions, and then working with any community-based organization that wants to be involved, and working a lot with the faith-based communities as well, because they kind of have extensive networks and social connections within their communities.
Great, thanks. Okay, I love this next question. These are great programs, but how did you get all of those spaces at no cost? So I'm not sure. I think Alyssa and probably Ben, but everyone feel free to jump in on this one. How do you get free space?
That's a good question. We've had a couple instances where we've had like physical spaces where we're using, whether it's for a meeting or to offer something. It's so far been in kind through our partners involved. So the municipality, I know for one of our communities, able to host meetings or sessions for youth, that type of thing. So that's what I'll say is in kind thus far.
And I would say from our end, we haven't gotten any of the space really. We do have our existing city spaces, community centers, libraries, etc. But what we found in the research and with talking with other municipalities that have implemented Resilience Hub programs is that a city facility is not necessarily a person's first choice during an emergency or to meet with their community, and they really prefer those community third places that they're already going to on a regular basis. And so part of our Resilience Hub program is, if you look at a lot of the research on Resilience Hubs, it really places an emphasis on that physical resilience of the building, resilient power, resilient, just making sure it's sustainable during an emergency. But we didn't want to exclude any community-based groups just because they didn't necessarily have a facility. And so again, we are working with different community-based organizations, and the Resilience Hub initiative, while it is important to have those physical gathering points for people, like I said, we don't want to exclude anyone, and we want to make sure that if there's those social connections in the communities, that those partners can still be involved.
Great, thank you. So the next question, starting with a great statement, Would love to try this in my community. And I think we're talking about Planet Youth here for youth and young children. However, community and government seems to be geared to seniors. Parents are searching to help their children get socially engaged, but the pandemic has been devastating to children. So I think I'm going to distill that question down into if community and government seems to be focusing on a particular population or group, how can we bring the group that we're working with to the fore? Or how can we find a win-win? Alyssa, I think this is a you question.
Sure. I guess I can just share from our experience at the time that we were sort of socializing this model as an option for our communities. It was kind of on the heels of the pandemic, and sort of, I think there were a lot of partners that were seeing that exact problem, that there was youth were struggling. And we also were able to show, just in terms of our Ontario Student Drug Use and Health Survey that happens every couple of years, just kind of twofold, the fact that our community is lagging in some ways when it comes to some of the well-being indicators, and then also that our data was kind of outdated. So we needed something to kind of bring us all together to be focusing on this population. And I think it just was kind of in everyone's mind at the time, like there was a little bit of urgency around that. So hosting a gathering of partners where we were able to present about this model as just kind of like, here it is. We were able to have some guest speakers and have a chance for the partners who attended to discuss amongst themselves and do a pulse check afterward, just to find out, is this something we're interested in? So just really kind of listening to what the community's needs are and what their perspectives are on, should we be doing this type of thing? So really following that before jumping in.
Great, thank you, Alyssa. Okay, the next question is that the person writing sees social and built environments intertwined with emergency management. So if we're expressing this as a wicked problem, how do we look to sectors like public health and emergency management to work together to plan a social or built environment that is also conducive to an emergency or evacuation scenario? Again, just a tiny question.
I can take a first crack at that. So when we were working on the new official plan, the pandemic started. And we had, right before the pandemic started, we had pitched this idea of 15-minute neighborhoods as an opportunity to advance health, equity, and inclusion, and all of those other pieces I reviewed earlier. And when the pandemic started, we started to unpack what 15-minute neighborhoods means for an emergency scenario that we were in. So we actually, at the time, we did some deep thinking around that those features, what are the design features in our communities that would better enable future communities of the future to be resilient in the face of pandemics or other climate or any kind of emergency. And we did find that the 15-minute neighborhood would provide us with many of those built environment and transportation levers to allow us to make those improvements. Over time, though, that's the challenge. This kind of work is long range. Our communities don't change overnight. And so when we work on planning policy like this, it takes many, many years to see the outcome on the ground. So unfortunately, it's one of those things where you're setting up future generations for resiliency, but you're not going to see the changes in the built form tomorrow to deal, with the next immediate emergency.
Absolutely. And from the emergency management perspective, I think Inge said it perfectly. But I think one of our challenges that I alluded to in my presentation was in emergency management, we've typically worked with our police responders, firefighters, paramedics, but we haven't had these conversations about built environments and social environments yet. And so I think we are still in the early stages of exploring these types of things. And so I think, like Inge mentioned, this is a long-term plan. And I think the thing we can do right now is just be aware of how all of this different work has benefits on one another. And so, like I mentioned, if you can connect with your local emergency managers, and if you are an emergency manager, connect with your local public health unit. I think these are really good conversations to start now, especially since we as emergency managers think about evacuations and emergencies in a specific way, which might not always be super conducive to how we're building our neighborhoods and in our social environments.
Great, thank you to you both. So the next question is for Alyssa, and it is, how might you go about creating an implementation plan for these local interventions in a way that is practical for where the city and town is currently at? And it almost sounds like it's not even just about the implementation plan from what you were presenting, Alyssa. It's the entire planning is done for where the city and town is currently at and where the youth is at, and that's kind of where you start.
Yeah, absolutely. It very much is meant to be localized. And again, Planet Youth has a model and like process that's followed, but they are always emphasizing you have to listen to where the community needs are and listen to your community. So essentially, there's quite a involved planning framework that they've got, like for each of the steps there's kind of processes to follow. So thankfully, which is it's great to be able to kind of follow that. And there is essentially in the steps, we're, like I mentioned, we're sort of engaging our community right now, and we're coming up to the next step, which will be around setting goals. And we're recommended to set 2 to 3 practical goals for this first like cycle that we're in. And then based on that, developing an action plan. So there's templates that they've got. But as part of that work on engaging community, we're looking at doing some community asset mapping to find out what is already existing in the community, because we're not meant to duplicate what's already happening, but more so just identify where are the strengths and where are some of the gaps that we can be addressing with this implementation plan. So yeah, so it's kind of just learning from community through the engagement that we're doing, and then following kind of that step on what we can take on for the next, 1.5 years until we do the survey again. So it's just kind of taking small bites of the process.
One of the mottos that guides my life, and this kind of leads into the next question, is there's only one way to eat an elephant, and that's one bite at a time. And the question here is, although the evidence shows the benefits of these initiatives, they also take a significant amount of time before there are noticeable outcomes. And I think in particular around health impacts. So the question is, what are some of the quick wins that have been shared with decision makers to show them that we are on the right track along the way?
I can just get us started. From the very beginning, we've always emphasized to leadership within public health and just to our partners that this work is going to take time. We're not going to see that outcome right away, maybe for a couple of cycles, but the process evaluation is sort of where we're kind of leaning on, is our coalition that we've pulled together. How are we working better together, maybe throughout this first cycle? Just kind of figuring out different smaller wins on like the process toward getting there, and logic models obviously help. And there are some articles, it might have been even the one that I had shared, it's in the slide from the researchers in Iceland, that it's kind of that process evaluation piece. So there's ways to kind of measure that progress without kind of seeing the final outcome, because of course it's going to take some time to get there.
Yeah, and I would say it is a long haul. We've been working on our Resilience Hub program for over 2 years now, and we still feel like we haven't really gotten it off the ground. But I would say, similar to Alyssa, the research project we did with the University of Mississauga, or University of Toronto Mississauga campus this summer, fairly low effort. We kind of pitched our idea to their research team about what we were trying to examine, and they came back with a ton of great recommendations that we could provide to different city divisions on different ways that we could increase social capital within those communities, whether that was recreation programming or different types of events for seniors and things like that. So I think there are ways to work with partners in a fairly low effort way that benefits them because they got their research goals out of it, that also provided us with some kind of actual tangible items that we can implement immediately.
So I'm actually going to jump in on this one. I'm in the process of doing a literature review with a handful of health units on demonstrating the effectiveness of healthy public policy work. And I think there are parallels because policy, just like this work, can sometimes take 10 or 20 or 50 years, or sometimes there is no policy at all. And what we're trying to do is figure out how people can measure that the work that they're doing is effective before we get to that adopting the policy work. And I think that there's a lot of parallels there. Alyssa mentioned logic models and also process evaluation. And I think sometimes when we hear the words process evaluation, we think about, how many bums in seats, how many brochures distributed, like how did we do things? But we can also think about it being, how did we go along the process from step to step to step? And a lot of the individual things that you will be doing, like Alyssa mentioned, partnerships, those things can be measured. There's lots of measurement tools for measuring not only who is at your coalition table, but what is that relationship like, or is the relationship progressing over time? Can you also do some measurements around community attitudes towards the work that you're doing? Can you see those shifts? And if you're working in a very specific domain of the social environment, for example, social support or social connection, in the webinar last week, I talked about specific measurement tools that exist. I mean, they are self-reported, so a little bit of a grain of salt, but you can actually collect some short to interim data that can show that, yes, you are making progress. I think the big trick is to plan that out from the very beginning. So when you're in the beginning stages of this work, or frankly, any work, thinking not only how are we going to achieve our ultimate outcome, but what are the things that we need to do in order to make that happen, and how we measure them. So I hope that helps. Okay, Inge, we have a bunch of questions about 15-minute neighborhoods. I'm so excited. So I'm going to sort of link them all together and then repeat them one at a time for you, because they're so very much linked. So concept of 15-minute neighborhoods, excellent idea for urban spaces. Are there suggestions or alternative interventions for rural communities? Another one is around the age-friendly community and 15-minute neighborhoods. And also a conspiracy plot around 15-minute neighborhoods, and someone asking if you can comment to the conspiracy thinking surrounding the 15-minute neighborhood. So do you want to start with rural?
I'll start with rural. I'll work my way through. Yep. No, that's great. I love those questions. That's great. So in Ottawa here, we have translated that 15-minute neighborhood framework not just to be relevant to the urban area, but also to rural villages. So for sure. So we want to see that the policies also apply to rural villages, and they'll have, commensurate zoning and secondary planning and that kind of thing attached to them. What does it mean in rural villages? It looks different from the urban area, but it does mean that we want to see a diverse range of housing types. Like, we want seniors who live, for instance, in a larger home in a rural village to have the option to move into something smaller and not have to leave their community. We still want children in rural villages to be able to walk to school, so we need those sidewalks. We still want to give people the opportunity to use active transportation and ensure that we do have those, shaded local streets with trees. So all of those things that characterize 15-minute neighborhoods in the urban area, those elements are also important in the rural villages. They just might translate a little bit differently. They look a little bit differently, So for sure. And we've actually done some mapping in Ottawa where we produced a baseline map for how all of the urban area as well as our rural villages score in terms of their 15-minute neighborhoodness, basically by evaluating the diversity of land uses, as well as evaluating the transportation network for pedestrians. So we've scored that. You can, I'll maybe send a link later, Andrea, where you can find that, but it's, you can take a look. Age-friendly, for sure. When we were working to develop the policies associated with the 15-minute neighborhood, all of those elements that support age-friendly community planning were all informing that deliberation of policy and the crafting of policies in the official plan. So, you know, again, being able to age in place, being a child and being able to, you know, like with the popsicle test, being able to access the things that you need, being an older adult and having spaces in your local community, third places, parks, public spaces, not having to rely on your vehicle as you know, maybe, you know, don't have access to a vehicle or are not able to drive at certain times of your life. So absolutely all those things are really interconnected, you know. And then that last one, the conspiracy. Oh, I tell you, that was just something else, you know. That was difficult for I think many planners in Canada working to advance more resilient communities and talking about 15-minute neighborhoods when that conspiracy theory emerged. It's misinformation, you know. It's this notion that that you'll be locked in physically into an environment, into a neighborhood, and you can't leave. Like it was complete misinformation, and you know, through you know, different social media kind of discussions that were happening. In Ottawa, we were very fortunate though, because our community has actually been advocating quite, you know, with real dedication for their desire for healthy, walkable 15-minute neighborhoods. So we are able to continue a really productive conversation around what 15-minute neighborhoods look like and how it translates into policy, you know, through that ripple effect as the official plan is implemented through different planning tools. But it's unfortunate because the notion of 15-minute neighborhoods is very much a planning idea that's much more accessible for those who aren't necessarily working in the urban planning field. You know, it makes it just a little bit easier to understand. And when these ideas are then, you know, co-opted and twisted into something that's completely not accurate, it does us all a disservice in building healthier, more resilient communities overall.
Thanks so much, Inge, for that 15-minute neighborhood marathon. So the next question I think is probably for everyone, and it is, how can public health units connect better with organizations or community groups that are better positioned to enhance the social environment? So maybe for anyone who wants to answer this question, maybe just think about one particular piece of advice or tip on public health units connecting better with other organizations or community.
I think this is tricky because oftentimes we have our mandates and public health, like things we're trying to achieve and goals and such. But sometimes I find it's helpful to have more of just like a meeting to kind of explore like what are commonalities, what are your priorities, more just like open-ended and less with an agenda. I find that it just really, it's just about listening to the partners and just better understanding them. And then the goals and the priorities can come after, but it's just, I don't know, I just think that that's a helpful way to approach connection with partners.
I love that piece of advice, Alyssa. I'm 100% agreeing with you because I find that we don't know how reasonable our advice is with our partners until we understand our partners. You know what I mean? And if you don't start from a place of building relationship and trust, it's really hard to advance new ways of thinking, which is what we need in this day and age to deal with all of these very difficult things we're challenged with. We need those relationships with our partners in other sectors and other communities, build trust, that builds an appetite for perhaps exploring innovative approaches, you know, that may have felt that you may not have felt comfortable with, you know, otherwise. So absolutely critical. I agree.
And absolutely, I agree with everything that's been said too. I think there's no one group that is better positioned than any other group necessarily for social environments, but we all benefit each other. And I think had you been talking to me 3 years ago, I wouldn't have known what active transportation or our infrastructure would have anything to do with emergency preparedness. But having had those conversations in some of those early meetings, now I have a better understanding for it. And I think some of our partners have a better understanding of where we can assist in the social environments as well. So I think it is that collaborative effort.
Great. Thank you so much, everyone. So the time has all of a sudden vanished, and we still have a whole lot of questions, but I am going to go down the list and ask this one. It's somewhat related. But does anyone have any recommendations on how to start a municipal engagement strategy, particularly with public health who are autonomous and not naturally tied with the municipality, in not in all cases?
I can take a start. We are a semi-autonomous board in Ottawa, so that is an advantage for us that we are part of the City of Ottawa as well. So that provides a natural entry point. But I don't know that we still have to, in our work, still make the case and have those conversations that we, similar to the answers we just provided to the previous question, develop those relationships in order to identify points of interest. So I think that starting a municipal engagement strategy is really about starting conversation. What is your municipality worried about? What are the things getting in the way of decision making or initiatives that will support your community? How can public health help?
Great. Thank you so much for that. Well, I just am in awe of all of the questions that we've had. They're fantastic questions, and I think we could probably carry on for another 15 minutes, but alas, our time is at an end. So I really want to thank Alyssa, Ben, and Inge for your presentations, for your conversation. A special thank you to everyone who joined here and my colleagues who supported us in getting this webinar actually happening. Um, we do have our third webinar coming up on February 5th, and the registration for that will likely go out in the next week or so, so keep your eyes peeled for that. And a reminder also to save the date for the Ontario Public Health Convention topic, which is going to be held on March 26th and April 2nd. And you can visit our website, tophc.ca, for details. And the last thing is that you are going to receive an anonymous survey after the webinar today, to get your thoughts and your perceptions. And please fill out that evaluation survey. It gives us such valuable information. And we really love to hear your feedback about what you thought worked, what didn't, what we could change for next time, etc. Thank you so much for being here, everyone, and have a wonderful day.